Welcome to Anthropometrics. After completing this course, you will be able to define the term anthropometrics, describe the 4 factors that affect growth, understand how to accurately measure heights, weights, and lengths, define body mass index, BMI, and interpret growth charts for clients. Anthropometrics. Now there's a big fancy word. So what does it mean exactly? Well, anthropometrics or anthropometry simply means the study of body measurements. In the WIC program, we take the heights, weights, and lengths of women, infants, and children so we can better assess their growth, development, and nutrition status. These measurements are an important step in helping WIC staff members determine whether or not there is a nutrition risk. Since these measurements are used by the WIC computer system to help identify risks, accuracy and precision are extremely important. That's what this lesson is all about, how to accurately obtain anthropometric measurements in order to assess risk. Let's begin this lesson by learning about the 4 factors that affect growth and development. It's no surprise that kids and adults come in many different shapes and sizes. If you look at kids in the same grade at any school, you'll see a dramatic difference in heights, weights, and body sizes between them. So what contributes to these growth and development differences? There are 4 factors in all. Click on each image to learn more about each factor. The first anthropometric measurement you'll be learning about is how to take the weight of an infant. And depending upon the clinic you'll be working at, you'll either be using an infant balance beam or digital scale. Both scales do a great job of determining an infant's weight. It's just that with a balance beam scale, you'll have to manually adjust it to determine weight, whereas with a digital scale, the weight is taken at the press of a button. You will typically be weighing infants and children up to about 24 months in age on the infant scale. After 24 months, many children will be able to stand on their own, allowing you to take their weights standing up. In some cases, though, such as a developmental disability, children up to 36 months can be weighed using an infant scale. On the next page, we'll talk about accuracy and precision when it comes to taking measurements. Note, the scales at your clinic may vary from those shown and used in this training. As you'll see in the coming slides, the measurements you'll be taking will be used to help determine if a child is growing on a healthy track or if a woman is gaining the recommended amount of weight during her pregnancy. So if you make errors in your measurements, then the growth assessment you'll be providing your clients will be in error too. This is where accuracy and precision play an important role. Accuracy and precision. These 2 terms sound similar, don't they? Well, let's see how they differ when it comes to taking anthropometric measurements. Let's say you took the weight of a child to be 12 pounds 3 ounces, and you reweighed and got 12 pounds 3 ounces again. Would you be accurate or precise? Yeah, precise. See, precision has to do with your ability to get the same result over and over. So what about accuracy? Do you think that 12 pounds 3 ounces would be accurate? Let's say you forgot to ask the mother to check her child's diaper and it was full. You know, a real mess. Ugh. So even though you were very precise getting the same measurement, this measurement would actually be inaccurate because a full diaper could weigh up to 2 pounds. See the difference? In these videos, you'll see how to weigh an infant using the electronic and balance beam scales. And as easy as weighing an infant might seem, mistakes are often made because of not paying careful attention to detail, such as if the child's arms or legs are hanging outside the scale, or if you're trying to rush through it because the child is fussy, moving, or crying. Errors in measurement can be avoided, and that's what you're here to learn. After watching the videos, we'll go over how to read the scale's measurements, as well as how to round off measurements so you can properly enter them into the WIC computer system. In this video, we'll be taking the weight of a 2-month-old infant using an electronic scale. Before weighing, have the mother or caregiver take off the infant's clothes such as shoes, pants, jackets, sweaters, or hats that will affect the weight. A t-shirt or onesie and diaper are fine. Also, have the caregiver check the infant's diaper and change it if needed, because a full diaper could weigh up to 2 pounds. Make sure a paper liner is placed onto the scale before weighing and that the scale is on and set to 0. Have the caregiver gently place the child onto the center of the scale. Younger infants should be measured lying down, but you might consider weighing older infants sitting up so they can fit comfortably in the center of the scale. Try to make sure the child isn't hanging on to the caregiver or that she isn't being held or touched, because that can throw the weight off. Also, it's best if the child doesn't touch the sides of the scale, and all of the child's body must be within the scale's tray, because this too affects the weight. Just allow the scale to adjust and stabilize. Most infant digital scales display weight in pounds, ounces, and tenths of an ounce. Record the weight to the nearest ounce. As you can see, this child weighs 11 pounds 10 ounces. And your supervisor will tell you about your state's requirements, as well as the unit of measurement you'll need to enter into your computer system. If your state requires 2 measurements, just have the caregiver take the child off the scale and allow the scale to reset to 0. And you can then have the caregiver place the child back onto the center of the scale for a second measurement. Once again, record to the nearest ounce. Again, these 2 measurements need to be within 1 ounce of each other. If they aren't, take a third measurement and use the average of the 2 closest measurements. This final value can then be entered into the computer system along with the date it was taken. Make every reasonable effort to obtain as accurate a measurement as possible by weighing the child alone, but we all know young children can sometimes be a challenge to manage. So if you find yourself in this situation, you can weigh the caregiver and child on the adult scale and then weigh the caregiver without the child. Then all you need to do is subtract the weight of the caregiver from the weight of the caregiver and child together, and you'll have the weight of the child. Record this measurement in the computer as weight obtained in caregiver's arms. That's how you measure the weight of an infant using an electronic scale. In this video, we'll be taking the weight of a 2-month-old infant using a balance beam scale. Before weighing, have the caregiver take off the infant's clothes, such as shoes, pants, jackets, sweaters, or hats that will affect the weight. A t-shirt or onesie and diaper is fine. Additionally, have the caregiver check the infant's diaper and change it if needed, as a full diaper could weigh up to 2 pounds. Make sure a paper liner is placed onto the scale before weighing and that the upper and lower counterbalance weights are at the far left at 0. Have the caregiver gently place the child onto the center of the scale. Younger infants should be measuring lying down. You may consider weighing older infants sitting up so they fit comfortably in the center of the scale. Make sure the child does not hang on to the caregiver, nor can the caregiver hold or touch the child. Also, the child cannot touch the sides of the scale, and all of the child's body must be within the scale's tray, as this will affect the weight. Move the lower weight over to the right until the indicator arm drops down. You can then move the smaller weight over to the right until the indicator arm balances in the center. Record this measurement to the nearest 1 ounce. Your supervisor will inform you of your state's requirements, as well as the unit of measurement you'll need to enter into your computer system. If your state requires 2 measurements, have the caregiver remove the child from the scale, return the weights to their 0 positions, then have the caregiver place the child back onto the scale. Once again, make sure the child does not hang on to the caregiver, nor can the caregiver hold or touch the child. Also, the child cannot touch the sides of the scale, and all the child's body must be within the scale's tray, as this will affect the weight. Move the lower weight over to the right until the indicator arm drops down. You can then move the smaller weight over to the right until the indicator arm balances in the center. Record this measurement to the nearest 1 ounce. These 2 measurements need to be within 1 ounce of each other. If they aren't, take a third measurement and use the average of the 2 closest measurements. This final value can then be entered into the computer system along with the date it was taken. This is how you measure the weight of an infant using a balance beam scale. Now that you've seen how to take the weight of an infant and a child using both types of scales, we'll take a look at how to read the measurements. We'll start with the balance beam scale first. Here's a close-up of a measurement taken on a balance beam scale. As you can see, the lower weight, which increases in 10-pound units, was moved over 1 notch to the 10-pound position. And the top weight, which increases in pounds and ounces, was moved to the 4-pound 5-ounce position, making this child weigh, 4 pounds plus 10 pounds is 14 pounds. Then add the ounces, which are 5, 14 pounds, 5 ounces. And what was this 14-pound, 5-ounce measurement based upon? The indicator arm being balanced in the center. Electronic scales are a bit easier to read because they display the measurement for you. However, not all infant electronic scales display the same units of measurement. Same for the adult electronic scales too. Now, electronic scales do all display pounds, but I'm talking about how they display the smaller units, such as tenths of an ounce, tenths of a pound, or quarter pound units. These smaller units, especially with infants who don't weigh that much to begin with, can mean a big difference in determining risk. Here's an image of the electronic scale. This scale displays measurements in pounds, ounces, and tenths of an ounce. So this child weighs how much? 9 pounds, 5 and 5/10 of an ounce. Excellent. You're doing great. Now, take a look at this image. Here's another variation of an electronic scale. This scale displays measurements in pounds and quarter pounds. Here, this child weighs, you got it, 35 3/4 pounds. What type of scale will you be using? Well, that really depends upon your clinic, but don't worry, really. Once you get to the clinic, your supervisor or another WIC staff member will go over all of these details with you. Right now, we're just going over the types of scales used by various agencies, how to use them, and how to read them. Got it? Good. If you use an electronic scale that displays units in tenths of an ounce, more than likely you will need to round the tenths up or down, as many of the WIC computer systems only take pounds and ounces. You know where I'm going with this, don't you? Thought so. 5/10 of an ounce or more gets rounded up to the next highest ounce, whereas 4/10 or less gets rounded down. Generally, when rounding numbers, this is usually the case. Anything 5 or greater gets rounded up to the next highest number, whereas anything 4 or less gets rounded down. Just like with infants, balance beam and electronic scales are used to weigh women and children in the WIC program too. Most balance beam scales will display units in pounds and ounces. Electronic scales could display in pounds and ounces, pounds and tenths of a pound, and pounds and quarter pounds. Once again, make sure you check with your supervisor or another WIC staff member as to the units your scale displays. In this video, we'll be using a balance beam scale to measure the weight of an adult. Before weighing, have the adult take off her shoes and any heavy clothing like jackets or sweaters. Make sure a paper liner is placed onto the scale before weighing and that the upper and lower counterbalance weights are at the far left at 0. Have your client step onto the scale and remain still. Move the lower weight over to the right until the indicator arm drops. You can then move the upper weight to the right until the indicator arm balances in the center. Record measurement to the nearest quarter pound or 4 ounces. Your supervisor will inform you of your state's requirements, as well as the unit of measurement you'll need to enter into your computer system. If your state requires 2 measurements, have your client step off the scale, move the 2 weights back to their 0 positions, then have your client step back onto the scale. Once again, have your client remain still. Move the lower and upper weights over until the indicator arm balances in the center. Record this measurement to the nearest quarter pound or 4 ounces. These 2 measurements need to be within a quarter pound or 4 ounces of each other. If they aren't, take a third measurement and use the average of the 2 closest measurements. This final value can then be entered in the computer system along with the date it was taken. This is how you measure the weight of an adult using a balance beam scale. In this video, we'll be taking the weight of a 4-year-old boy using an electronic scale. Before weighing, have the caregiver take off the child's shoes or any heavy clothing like jackets or sweaters that might affect the child's weight. Make sure a paper liner is placed onto the scale before weighing and that the scale is on and set to 0. Have the child step onto the scale and remain still until the scale finishes adjusting, which is usually a couple of seconds. Depending upon the type of electronic scale you'll be using, this measurement will be displayed in pounds and ounces or pounds and tenths of a pound as pictured here. Your supervisor will tell you your state's requirements as well as the unit of measurement you'll need to enter into your computer system. Write down the weight and then have the child step off the scale. This will cause most electronic scales to reset to 0. If your state requires 2 measurements, you can then have the child step back onto the scale for a second measurement. These 2 measurements need to be within 1/4 pound or 4 ounces of each other. If not, take a third measurement and use the average of the 2 closest measurements. This final value can then be entered in the computer system along with the date it was taken. This is how you measure the weight of a child or of an adult using a digital scale. As you had seen in the video, the 4-year-old boy weighed 40.6 pounds. Okay, I get 40 pounds, but what about the 0.6? Great question. It's pounds and tenths of a pound. How would you have known? Well, that's where you'd ask someone at your clinic, like a supervisor or another WIC staff member. Now, let's say you needed to convert this measurement from tenths of a pound into ounces because that's what your WIC computer system requires. How will you do this? Well, no worries, we've got you covered. That's what this table is for. You can find it in your job aid under the Resources tab. One like it should also be posted at your clinic in case you need to do this type of conversion. Looking at this table, 6/10 of a pound equates to 10 ounces. So 40 pounds, 10 ounces is what you or someone else would put into the WIC computer. Now, let's say the child weighed 35 3/4 pounds, and your WIC computer system, once again, took pounds and ounces. How many ounces would 3/4 of a pound be? Using this table, you can see that 3/4 of a pound equals 12 ounces. So this boy weighed 35 pounds, 12 ounces. See? This conversion stuff is a breeze. Just be aware of the type of scale you have and your agency's requirements, and you'll be good to go. So what are my agency's requirements? Yeah, great question. We'll go over that next. Since this is a general course on anthropometrics, we cannot cover every agency's height, weight, and length requirements. For example, one state might require only one measurement of an infant on the electronic scale, whereas another might require two. One agency might require these two measurements to be within 1/2 ounce of each other, while another requires it to be just one. Now, it would be great if all the agencies had all the same equipment and recorded all the measurements in the exact same way, but they don't. Not yet, anyway. So what do? That's what your supervisor or your local policy manual will provide you. Once you start working at your particular agency, make sure to ask your supervisor and to look through your policy manual to get familiar with your agency's requirements. Now that you have a good understanding of what is needed to accurately weigh women, children, and infants, it's time to learn how to measure lengths and heights. We'll start with infants, just like we did before. Infants 24 months or less need to be measured lying down. Makes sense, right? After all, if the child cannot stand, how else would you measure him? This lying down measurement is called recumbent length and requires a recumbent length board as shown here. The recumbent length board has a fixed headpiece and sliding footboard that rests against the infant's feet. The foot area is where you'll read the measurement. Units for this measurement are entered into the computer system as inches and eighths of an inch, such as 20 and 3/8 inches, which are the same units used for heights of women and children. As mentioned, this device is typically used with infants and children up to 24 months. However, it can still be used with children up to 36 months if the child is less than 30 inches in length while lying down, or if he has trouble standing on his own due to something like a developmental disability. In this video, you'll see how to measure recumbent length. After watching this video, we'll go over how to read the measurements, as well as rounding them up or down if needed. In this video, we'll be measuring the length of a 2-month-old infant using a recumbent length board. Before measuring, have the caregiver remove shoes and any heavy clothing the child might be wearing. Make sure that a paper liner is placed onto the board and that the child's diaper is dry. Have the caregiver change it if necessary. Since the headboard needs to rest flat against the child's head, make sure anything like hair clips or hats are removed. Some hairstyles, like braids, can also prevent the headboard from resting flat and can cause an inaccurate measurement. Under these circumstances, have the caregiver do her best to flatten the hair. If the caregiver is unable to do so, record it in the chart. The caregiver will then gently place the child flat on his back, then hold the child's head firmly against the headboard by gently cupping their hands over the child's ears. You can then bring the child's legs together by holding both of the child's ankles with one hand. Use your hand and arm to firmly but gently push down on the legs to straighten them out. Make sure the child's head is flat against the headboard and both legs are straight and feet are flat against the footboard, as this will ensure an accurate measurement. You can then slide the footboard flat against the bottom of the child's feet using your free hand. Make a mental note of this measurement to the nearest 1/8 of an inch. 2 measurements are required to ensure accuracy, so move the footboard out. Recheck the child's position to make sure the child's head is flat against the headboard and that the legs are straight. Then reposition the footboard. Make sure the child's feet are flat before taking the second measurement. These two measurements need to be within 1/4 of an inch of each other. If they aren't, take a third measurement and average the two closest measurements. This final value can then be entered in the computer system along with the date it was taken. Since children are not comfortable in this position, they might become fussy or cry. Keep patient and focus on getting two accurate measurements. With some time and practice, you'll perfect your ability and become very skilled at this technique. This is how you measure the recumbent length of an infant. As you heard previously, each 1-inch increment on the recumbent length board is broken down into eighths of an inch. And since you'll need to enter the measurement to the nearest eighth inch into the computer, you'll need to round up or round down if the measurement is in between eighths. You know what that means, right? Anything beyond the halfway point gets rounded up to the next higher eighth, and anything below, you got it, gets rounded down. Take a look at this image. Let's say the heels of the child went to the red line. Since the heels went further than the halfway point between 4/8 and 5/8, you'd round this measurement up to 21 5/8 inches. If the measurement was less than the halfway point, you'd round down to 21 4/8 inches. What if the measurement was right in the middle? Exactly. You'd round it up to 21 5/8 inches. Let's face it, children grow quickly. In fact, by 24 months, most toddlers will be able to stand on their own, so you will measure them standing up using the stadiometer, which is the device used to measure the heights of adults and older children. We'll talk about how to do this in the coming pages. Why is this so important? Well, using the child's height and not length will allow you to calculate the body mass index of a child aged 2 and older. That's why we'd like to take height as soon as the child is 2 years old. Now, we'll talk about the importance of body mass index in Lesson 2, as well as how to interpret growth chart information for your clients. But for now, realize that body mass index is an important number used to determine if the child is at risk for any nutrition-related concerns. Oh, one more thing. Some computer systems auto-default to recumbent length for children 36 months and younger. This means you'll want to make note of taking standing height in the lab, so when you or someone else enters it into the computer, the system will be able to calculate the body mass index for you. Now that you've seen how to take recumbent lengths of infants, you are now ready to measure the heights of adults and children over 30 inches using a stadiometer, which is the official name of this device. You gotta love the medical industry and their use of technical words. The stadiometer can be wall-mounted, portable, and either electronic or manual. Instead of a movable footboard, as in the recumbent length board for infants, the stadiometer has a movable headboard to accommodate for differences in height. Manual stadiometers display measurements in inches and eighths of an inch, while digital or electronic stadiometers display measurements in inches and decimals, which need to be converted to eighths of an inch. In this video, we'll be measuring the height of an adult using a manual stadiometer. Before measuring, have the client take off her shoes and any heavy clothing she might be wearing. Since the headboard needs to rest flat against the client's head, make sure anything like hair clips or hats are removed. Some hairstyles, like braids, can also prevent the headboard from resting flat and can cause an inaccurate measurement. Under these circumstances, have the client do her best to flatten her hair. If the client is unable to do so, record it in the chart. Have the client stand under the headboard. Make sure the client's heels, buttocks, shoulders, and head are all flat up against the vertical beam before lowering the headboard. This will ensure an accurate measurement. Loosen the wing nut that holds the headboard in place, then lower the headboard gently onto the client's head and retighten the nut. Read the measurement at the read here arrow or designated line to the nearest 1/8 of an inch. 2 measurements are required to ensure accuracy. Loosen and move the headboard up. Recheck the client's position to make sure the client's heels, buttocks, shoulders, and head are all flat against the vertical beam. Lower the headboard firmly onto the client's head and take a second measurement. These 2 measurements need to be within 1/4 of an inch. If they aren't, take a third measurement and use the average of the 2 closest measurements. This final value can then be entered in the computer system along with the date it was taken. This is how you measure the height of an adult or child using a manual stadiometer. In this video, we'll be measuring the height of a 4-year-old boy using an electronic stadiometer. Before measuring, have the caregiver remove shoes and any heavy clothing the child might be wearing. Since the headboard needs to rest flat against the child's head, make sure anything like hair clips or hats are removed. Some hairstyles, like braids, can also prevent the headboard from resting flat and can cause an inaccurate measurement. Under these circumstances, have the caregiver do her best to flatten the child's hair. If the caregiver is unable to do so, record it in the chart. Have the child stand under the headboard. Make sure the child's heels, buttocks, shoulders, and head are all flat against the vertical beam before lowering the headboard onto the head. This will ensure an accurate measurement. Lower the headboard gently onto the child's head and note the measurement. Most digital stadiometers measure in decimal values, which you'll need to convert to eighths of an inch. You'll learn how to convert these numbers later in the course. Your supervisor will also inform you of your state's requirements as well as the unit of measurement you'll need to enter into your computer system. 2 measurements are required to ensure accuracy, so raise the headboard, double-check the child's position to make sure the child's heels, buttocks, shoulders, and head are all flat against the vertical beam, lower the headboard firmly onto the child's head, and write down the second measurement. These 2 measurements need to be within 1/4 of an inch. If they aren't, take a third measurement and use the average of the 2 closest measurements. This final value can then be entered in the computer system along with the date it was taken. This is how you take the height of a child using a digital stadiometer. As you know, each 1-inch increment on the manual stadiometer is broken down into eighths, just like with the recumbent length board. And like with recumbent length, you will round your measurement up or down if the measurement is between eighths. Each stadiometer also has a read here or designated line to mark the measurement. Per the read here area in this image, the height of this individual would be, 67 4/8 inches. Digital stadiometers make taking heights pretty easy. Just move the headboard up and down and the measurement adjusts on the display. Easy stuff. However, since this is a digital display, you'll need to convert the decimal values into eighths of an inch. The following table will help you do that. We've included it in the job aid too. Oh, let's face it, there will be times when kids will not cooperate like you want them to. They can fidget, squirm, and even cry, making your measuring difficult. And if you work in an agency that requires 2 measurements to be within a certain range, like 1/2 an ounce for an infant's weight, and they aren't, what do? In cases like these, you might need to take a third measurement, then average the 2 closest measurements and enter it into your WIC computer. If you find yourself in this situation, make sure to check with your supervisor as well as your agency's policy manual about what to do. Before you head off to learn about what the body mass index is in the next lesson, or BMI for short, and how it's used in growth charts to assess risk, there's one final thing to cover. That is, what if a mother or caregiver comes in with previous weight, height, and/or length documentation from her healthcare provider? It makes sense to be able to use this information, doesn't it? Yes, it does, and you can, but there are some things to remember. The documentation must have been taken within the last 60 days and must reflect current health status, i.e., was the woman pregnant then? The documentation must be official paperwork from a healthcare provider, like a physician's prescription pad, letterhead, or a computer printout with the doctor's name and address on it. Make sure to enter these measurements into the WIC computer system using the date on which they were taken. This contributes to the overall health assessment. You can still take anthropometric measurements that day, if possible. However, this is not mandatory, but suggested. The more measurements we have on our clients, the better we can assess their growth. In this lesson, you learned about the 4 factors that affect growth and how to take anthropometric measurements using equipment such as the balance beam and electronic scale, a recumbent length board, and how to measure height using a stadiometer, both manual and digital. You also learned about needing to ask your supervisor and checking your agency's policy manual for the number of measurements you'll need to take, the units of measurement your equipment displays in, whether or not you'll need to convert the units, when or if a third measurement is necessary, and whether or not you can use your client's previous documentation.